have that option.
Oh,
and
there it
I-
goes. Somebody pressed it.
Okay, I'm recording to a cloud and I'll figure out how to retrieve it and share it with everybody.
Thank you.
Okay. Let me go back to where I was at there. So I was getting into the area where everybody understands most of the basic criteria. And with that, we start talking about Americans with Disabilities Act. Is that clear on everybody's screen to see these right now? I got to zoom out a little bit.
They're very clear.
Okay. And so when you're talking about sidewalks and you're talking about, let me make sure I get to the right page, cross slopes and everything else, there's a few elements in there that you can't fix or repair with mud jacking or grinding or anything else. And if you can see this picture of a typical sidewalk, it's displaying a couple of the items I'm talking about. And if you follow my cursor down here, there's a cross slope, which is indicating the sidewalk can't cross or tilt sideways more than 2%, okay? And then there's a longitudinal slope, which we're talking about a 5% max going downhill or uphill, which is very difficult for people with disabilities to navigate. So here you're talking about cross slopes and you see this, here's an illustration I had in one of my classes, how difficult it just shows what we don't all feel or understand, but this is why the federal government made the Americans with Disability Act, because there's people that really want to traverse our communities and can't because of the limitations. So anytime you make or alter a transportation, you're working with sidewalks or anything else, you have to do your best to attempt to correct all these, okay? So here's the cross slope. And then here's where you're dealing with the longitudinal slope. It's just, none of us really want to be in their boat, but you can only imagine the effort that they're taking and the challenges they have just to go around the block. And, you know, I've heard before when I met with residents, well, I never see anybody out front, but still, I really don't like hearing that excuse. I really like to have empathy for all those that have different challenges that we do not have. And in addition to believing in the ADA requirement, I just think it's very compassionate and the right thing to do.
Rob,
Yes.
there was a man with disabilities who had a column, and he wrote something that just stuck with me. He said, there are those of us with disabilities right now, and the rest of us are temporarily able-bodied. But if you fall down and break a leg or get older or have a stroke or anything, whether you're 17 or 97, it can be you one day.
That
So
is well put. And as I'm getting older, I'm appreciating a lot of other things too, like that. So thanks for your point. Here's just another picture illustrating a 5% longitudinal slope and the 2% cross slopes right here. And then another ADA requirement that you have seen coming up through our neighborhoods is we have truncated domes. And this is just to indicate an indicator to Americans with disabilities that they're entering the street. And also to meet this 5% longitudinal slope, a lot of times you can't do that when you have a steep slope right here. You got to flatten this all out and you got to go deeper in the ground. And when you go deeper in the ground to flatten out the sidewalk up here in this corner, you could see that you end up keeping the same grade in the front yard. And so in essence, the front yard is a little higher and the sidewalk's a little lower, and you might see these rolling curbs or retaining walls throughout the neighborhoods because of these efforts to meet Americans with disabilities. So to look at a typical bad cross slope, here's a really bad cross slope. And if we were to grind down this edge right now, that would not satisfy the ADA requirements. You would still have a bad slope going towards the property, and then you'd have this slope going towards the street at 2%. And the same thing if you attempted to mud jack any other ends like that. So I'm just saying mud jacking and grinding can be counterproductive. There's no guarantee the slab won't crack while they're jacking it. You don't have an opportunity when you replace the sidewalk. So when we replace the sidewalk, we'll take out these flags and our contractor will use a root grinder and cut out all these roots that are underneath the sidewalk and then put the sidewalk back in. Where that does not stop this piece of sidewalk from raising again, it significantly slows the process, and hopefully it'll be okay for 20 years until the next time we're back in the area. Last time I looked into it, mud jacking and grinding, despite not being able to meet ADA requirements, it's really not comparable to the price of our sidewalk program. We bid our sidewalk program out on over a $500,000 project. This will be competitive billing or bidding, which is going to really lower the price. We're looking for a 20-year fix. Our contractor is going to guarantee these pieces of sidewalk for 1 year. And additionally, we offer convenient sidewalk options. So I think that's covering all of our criteria. Here's an important aspect is that we recently changed in 2018. If it's self-explanatory on here, is that a lot of residents understand the need to maintain the sidewalks, but then when they get hit with this bill, it really crushes some personal budgets. And myself and city council had a lot of sympathy, and we worked with our finance department and came up with a billing process or a installment plan where invoices up to 1,000, you can postpone paying that for a term of 1 year. This is the last time we had the project up here, so that's 2019, but it'll be the spring of 2022. Invoice between 1,000 and 2 will give you a 2-year financing at 6% interest, and over 2,000, they will spread that out over 3 years at 6% interest rate.
Do they have costs set up for each flag right now?
I'm sorry, I couldn't hear you.
Is there a cost set for each flag replacement right now?
Okay, well, I'm getting to that part right now. Let me go 1 second here and I'll bring up where I was at here. So that's our criteria. Now we're talking about the cost, and fortunately, I really haven't heard it from this group, but there's a lot of rumors and talk that have gone on with past sidewalk programs, and you hear some things that are absolutely not true out in the Facebook forums and everywhere else, that it's just a money grab. The city's making money off this. And I just want to say that is absolutely not true, and make sure you guys understand that. And to the point is that a lot of communities put up administrative markup on this cost to cover staff costs and other costs that the city has to incur to run a program. But we've faced a lot of tight budgets, and this has been batted around many times in our conference room, with our city council members, but they've always stood strong that this is not a place where we want to pass on any administrative costs, and we're going to continue to do so. So we're going to publicly bid this project. It's going to be advertised. We're going to have an open bid process. It's going to be open out loud at the city clerk's office. The references are going to be checked, and award of recommendations is going to be put before the city council. So to the question of what it's going to cost, we don't know yet. We expect this to be awarded at the city council meeting on March 2nd or the first Monday in March. But right now, we are having a difficult time estimating our construction costs because material and supplies and contractors, material is short. Some contractors are going out of business. Some monopolies are occurring. And we're not surprised when our estimates are blown out of the water lately. Just unfortunately, it's very difficult to estimate a project. So a very rough, volatile estimate that I cannot guarantee is we're looking probably at $150 for each 125 or 25 square foot flag. So that's one 5 by 5 square a sidewalk for approximately $125.
Great.
Um,
Sorry, I'm looking at this list of questions.
I get the question, would it be cheaper if I get my own person to do it? And the answer is always no, because the city is getting a lower price because they're doing so many all at once than you would get by having somebody coming out and doing just a few.
I agree, Marian. Thanks again for pointing that out and taking us in that direction. Is that obviously we're going to get a quantity scale when we're bidding out a whole half square mile, and we're dealing with over $1 million contract, and we're going to get a professional contractor on board. But upon receiving your notice, you will have an opportunity to replace the sidewalk on your own, but you'd have to follow our standards and pull a permit for the cost. And it is your option, but I will advise against it because typically, and it has happened that where some fly-by-night contractor or somebody tries to do it themselves will come in and do the work, and we'll go out there and literally just shake our head because the work is so shoddy, does not meet the ADA standards. The homeowner ended up paying the contractor, and we're still continuing with our sidewalk program and replacing the sidewalk. And there has been occasions where homeowners had to face the consequence of paying for this twice because of that. I've met with the homeowners in the past that said, I have my own concrete business. I can't afford to get my own guys out here and do it at this cost. Explain to me how you're doing it, and we really just had to talk to them about the economy of scale of talking about a $500,000 project.
So,
Rob,
if
yes.
someone has a pink dot on a square or flag of their sidewalk and they're questioning that, do they contact you? Do they contact your guys? Or
So here's a little timeline. What's going to happen is we expect to award the contract on March 2nd at the city council meeting. During that, after that's awarded, we will take all the sidewalk cards and do a calculation of an estimate of what it's going to cost of everywhere pink dots are. And the pink dots are representative where our engineering technicians went out, they inspected your sidewalk, and they placed a pink dot, and they have a card, and they indicate on a key of the card why it should be replaced and what the square footage is. They'll take that card, they'll do the calculations, they'll put that all together, and they'll include a flyer on your financing, the FAQ questions, and your sidewalk card, and the exact cost of what we estimate your property to be, and they'll mail that out to you. So the key will indicate why the flag needs to be replaced, and the pink dot indicates that, yes, that flag is on a list to be replaced. And when you get the sidewalk card, there'll be a period up until we start construction where I'm very proud of this program too, is that we take the time to bank 15 minutes apart, and we'll meet with as many homeowners as it takes to personally meet with them, go out there, look at their sidewalk with them, ask any specific questions that they might have or they don't understand or anything going on. And we'll re-inspect the sidewalk at the same time. Is when our engineers go out there, they don't sit there with the level and measure the 2% cross slope and the 5% longitudinal slope, but they are really awesome. They are really awesome and have a really good eye for slopes. But I will go out there and we'll re-inspect it, and we'll lay a level on there. If there's something that you don't think meets our criteria, we are more than happy to meet with you. And then fair chance we might take a piece off because you're the property owner, you're there, what's going on, so you can see it. And our inspectors, traversing the sidewalk in the neighborhoods trying to complete hundreds of houses in a day. So most of the time, a lot of the time, we can remove one flag maybe, but sometimes we get out there and we say, well, there's a chance that they didn't mark enough, and we might need to add another one. But what we're going to do is take a very long, deliberate reinspection of your sidewalk and talk to you about any questions that you might have.
Pat, it looks like Pat has a question. So Pat, you're gonna have to either unmute yourself or so we can hear you. Unless Dawn, can you do that?
I can't unmute people.
Okay. Pat, can you find the microphone and click on it? Yes.
Okay, and I hope I don't lose you guys again because I keep losing you. But I have a question. And my question has to do with the trees, with the little trees that are planted in front, along the curb in front of our houses. I have 3 pink dots in front of my house, and one of them is right opposite the little tree. And I'm wondering if they must remove the tree in order to put in the sidewalk square, because this is the 5th replacement tree that I've had. And I finally got one that seems to be growing and doing well. And I hate to think that I'm gonna lose a tree again.
That's a very good question, Pat, and I appreciate that. It's hard to say from sitting here on Zoom what's happening with your tree, and I don't want to get too specific with there, but take us up on our offer to meet you on site, and we'll talk again about the sensitivity of the tree trying to grow there, and we'll give you a good assessment, let you know what's going on with your tree. And that goes all around for everybody, really. For specific questions, we will come out and we'll have a very pleasant conversation and talk about what needs to be done and listen to you and talk about any
How do we
personal
contact?
example that you might have.
How do we contact you?
What will happen is when you receive your sidewalk card, there'll be an invitation with the phone number on there to call for a reinspection.
Okay, thank you. Thank
And go ahead. Any other questions now?
I was gonna say, just looking through the list of posed questions, if people want to have more work done, is that something they can bid out from the same contracting company?
Yes. Well, what would happen is right now we don't know who we're hiring, and we talked to them at our pre-construction meeting, and it all depends on how busy they are and how quick they got to move to another city, or if they're working, looking for additional work. But what we do is we try to coordinate it with the contractor, and our lead technician, Jennifer Wilson, will take everybody's number down and address and hand it to the contractor and let them know that they are looking for extra work. And we will work with them and try to get them to do it, but no guarantees.
The aprons on our driveway, those are homeowner responsibilities?
Yes, they are. Now, on the aprons, we have a little more control on that with our contractor. If you want to have the apron done on your driveway, you let us know, and because that work is in the right of way, they are contractually responsible to do it. We are having a sidewalk replacement program, so our ordinance dictates that we have to look at the sidewalk and make sure everybody replaces it. But your drive approach, your apron, we don't have any ordinance. It's not where somebody needs to walk, but for your convenience, we can come out and Jennifer will meet with you, measure your drive approach, give you an estimate based on our bulk contractual rates, and you can agree to have your apron done or not.
Great. Does anyone have any further questions or other questions that we've not addressed?
Yeah, do it. But
Did think of a couple points I'd really like to bring up also is that a common issue is we're going to, in the letter that comes out, we're going to ask you to contact us and let us know if you have sprinklers, because we make every effort to not damage them. But sometimes we don't know they're there until they pull up a sidewalk card. And if a homeowner indicates they are, we'll mark it up and do our best not to damage it. But, you know, any damage is done to your lawn or your sprinklers, we'll hold the contractor responsible for, but please let us know if you do have an underground sprinkler system.
And piggybacking off of that, please, if you do have a underground sprinkler system and you have slabs replaced, please try and run that system as soon as possible, after the slabs are replaced. So if there's any issues, you can notify us quickly while the contractor's still around. We can have them addressed immediately. Because I can't tell you how many times, some people call 1-2 years later because they, didn't have their sprinklers running or they never tested them after the construction. And we don't have the, once we release the retainage for the contractor, we don't have the teeth to go after them because we're not holding their money anymore. So once the construction takes place, please test everything that may have been damaged immediately and let us know. We'll make it right.
Question.
Yeah, go ahead, Sandy.
I wasn't sure.
Okay.
At the same time we're doing the sidewalks, are we going to be addressing anything within our street at the same time? We've got a huge raised piece of cement that's coming off of Roanoke and 10 when you come into our sub. It was addressed at one point. When you come down, when you make it right off 10 on Roanoke on the wood side, you got a big drop there. And even my brother-in-law said the same thing. What are they doing about it? They've addressed it once, never went back to it. Can we do that at the same time, or is that not going to be part of this program?
Well, that's another good question. That will be a totally different contract. And as you can imagine, we have a lot of needs throughout the city for street repair and, and so forth. And we do it on, we have a PACER rating, which rates how bad each street is. And we do shift it up. We'll get some, and we'll have a running list. And a certain amount of money is awarded by city council every year to come out and make individual repairs. And we'll spend the money appropriately on the worst of the worst in the top of the list. But at 10 Mile on Roanoke, you said just south of 10 Mile Road, we'll look at that piece and we'll make an assessment and we'll put it on the list where it belongs and properly assess that.
Okay, with regards to the ADA that you were talking about and the cement and everything else, on the corner, especially right around, I think it's, and don't quote me, I think it's not in Coolidge area. I think where the drains are. Some of the problems, well, let me just add one thing. The drains that are going down with regards to wheelchairs, if the drains aren't in circles instead of, I'm going to call them zigzags, if you will, wheelchairs, the wheels are getting stuck in the grids going across. If it's in a wavy form, if they're in circles, the water can drain through without the leaves. With the wavy patterns of the drains, wheelchairs are getting stuck in that. You might want to keep that in mind along with ADA.
Will do. Sandy, that just so it might be easier, could you please give me your phone number and I'll call you about an exact location and
Sure.
We'll have an engineer go out and look at it.
Sure.
What's your number?
My home number is 248-542-3407.
Thank you.
Yeah, I think it was Land Court. I can't be specific, but I think it was in that area.
And I guess that brings me to another point is I think I've seen on the questions that somebody's walking their kid to school and they see a large crack or a 2-inch lip and it's not marked. If you've seen our schedule of how we go through all these neighborhoods, that's our scheduled sidewalk replacement program. Outside of that area, we do a lot of repairs on miscellaneous concrete. It costs a lot more, but when a trip issue is reported to us, we take it serious. We'll go out, assess the property, and on these areas that are outside the area, and because whatever's going on, this house and property is becoming a hazard before we're going to get there on the sidewalk replacement program. We'll put them on the miscellaneous concrete program, and we'll do one-offs outside this area. But we like to stay in the scheduled area so we get an economy to scale, tell the contractor everything's going to be right here. But if a resident does have a random complaint about a one-off house, we will have to add it on to miscellaneous concrete and it'll cost them more to have that repaired. But we will address those problems when they're reported to us.
Very good. I appreciate your feedback.
Thank you.
Well, I don't know whether individuals are going to necessarily, I mean, you're giving them the opportunity to challenge the replacement. But in walking around, which I and neighbors do, I got to tell you, I look at so many of these squares and I see all your criteria, and for the life of me, I can't understand why there's a pink dot on them. And some of them I know. What's the lift requirement on? You had it on like no more than 3/4 of an inch.
Correct. And
Yeah.
you're- and
It looks
the
like-
really,
Half inch.
Well, it says I think 3/4 on your. Take a look at it. I might be wrong.
what you're really probably looking at is when you're meeting an ADA requirement, because when it starts sloping 2% the other way towards the
Right.
house, or more than 2% towards the street,
Well,
those flags might look like there's nothing wrong with them, but there is.
I guess that's up to the homeowner to challenge it, but I
Yeah.
just, it struck me that it was, and certainly we want this to be a walkable community. And hello, I've tripped, on a raised portion of the sidewalk. So I understand it's a hazard, and other people I know have as well. But with ones that are so small, I mean, all the other suburbs around here grind those down. You just walk right into Pleasant Ridge. They're grinding them down. Birmingham does it. Ferndale does it. Madison Heights does it. And the idea of having to replace entire slabs because something's 1/4 of an inch high seems ecologically, financially, too much.
A couple of points to your questions there, Peter, is again, we love the opportunity to meet individuals on the property and explain why that piece of concrete is being replaced. It's, they look at it as something like a small 1/4 or 1/8 inch lip, but sometimes there's more to it, and sometimes maybe it doesn't need to be replaced. But when you say ecologically, just want you to know is that concrete replacement is all recycled materials. If you ever see a construction operation, they divide the concrete up and take it to a separate crushing outfit and repurpose all that. So ecologically, it's not detrimental to replace the concrete. And financially, I'm going to tell you that if it's a little lip or whatever is going on, compare the cost, but I think it's going to be something else, but comparably on the cost, more than likely our sidewalk replacement program at $500,000 is going to be comparable to the cost of grinding that down. And you're also going to get the opportunity to see what's going on underneath it. Either a sewer your sanitary lead might have settled, or a tree lifted it, or some freeze-thaw cycles lifted it, but we get to take that out, fix the grade underneath it, and hopefully be done with it for 20 years.
Well, most recycling is pretty toxic in and of itself. And anytime, I mean, if you think about all that's involved, how do you break it up? Where do you transport it? The existence of the facility. So if at best it's a wash, in terms of environmental. But why Oak Park? I mean, what don't all these other suburbs know that Oak Park does, that Oak Park won't grind down? And part of it is Pleasant Ridge is an upscale community. This is a working class community. There's a woman next door to us that's a single mother with three teenagers, and she's going to get a bill for $500. And I look at these and I'm thinking, I can't see a one that needs replacing.
Well, that's again why we welcome the opportunity to meet with her personally out there and to speak with the other communities. For the other communities, I can't, but I know we are in a very litigious society. It's a federal law that you have to meet ADA requirements.
Right, sure.
And I'm going to assume they are, but you can't correct these problems without replacement and still meet ADA requirements. And a lot of what ifs in those questions, but we would be more than happy to meet with the homeowner to question something needs to be replaced.
Yeah, I don't mean to be argumentative, although I am, but
No, I appreciate good questions.
I mean, they must have the same concerns, both in terms of lawsuits, in terms of resident safety, and in terms of meeting ADA requirements. Yet every single one of them, the city takes on the cost of grinding those down. And we're not talking about three, like those ones around tree roots. We're talking 1/4 inches. I'm just talking about a way to, to save money all the way around.
Well, most communities, it's the homeowner's responsibility.
Right.
And a lot of that is determined when your city's found it and your city council, and they're going to be planting subdivisions, and a developer wants to come in and he wants to put houses in, and he wants to put houses with sidewalks so it's walkable. And part of the agreements are, okay, we're going to let you guys do this, but you guys still, the homeowner's going to have to maintain the sidewalk, keep it in good condition. Similarly to a homeowner has to shovel the walk, even though it's in the public right of way, and they got to cut the grass in the berm area. It's just the way the founders of the city agreed to let developers come in, and it's a very typical way.
I don't think that answers it, but thank you.
Okay.
Anyone have any further questions? I'm scrolling through just looking for hands to see if anybody does. Feel free again if you want to drop in the chat or unmute yourself. I'm assuming you're also reachable, Rob, right? Like,
Oh, for sure. Definitely.
I think you answered a bulk of what we have on here. It's like I'd like to.
I actually have one more. Full disclosure, I have no pink dots on there are no pink dots on my sidewalk. But what about it when it looks like it was contractor error from the time before, like things that, the top layer is scaled off, and I mean, obviously you can't go back 20 years and get it.
Yep, I just seen that on there. How I can answer that one is, when they put the original sidewalk in, when the houses were built in the 40s and 50s, and it wasn't subject to any weathering, freeze thaw, roots, or anything going on, we wouldn't have to run a sidewalk program. So to think about why is it not, or suggest it wasn't put in right in 2000, it's a lot of what ifs or whatever, but I do know I was around at the time. We had good inspections then, and we have good inspections now. And I expect some of the flags we're putting in now and replacing might be the same ones 20 years from now, because they're in the same area with same soil conditions or root conditions and everything else.
Thank you.
Yes.
Is a 1-year standard warranty on concrete work, or is there a way to somehow you guys negotiate longer? Or
So here's what, I mean, it's been, Jeff, it's been a few years since I sat down with the contractors, but when we require a 1-year warranty, that's nothing they're giving us free out of their good gracious, okay? So we are looking out for our residents and ourselves on the best interest. And we talked about the prices that I can't remember the specific, but a 1-year guarantee is very feasible and cost effective to offer to our residents. And if we start putting 5-year requirements, the price of this project's going to go sky high.
looking to see if Charlie's joined us yet, and I don't think he has.
No, he's not here yet. I'm watching for him.
And we have about 15 minutes left of our scheduled meeting. So I feel like we should open the floor to ask the mayor too, if people have questions for Marian. I know that
before we move on, Jeff, just one quick thing. I was quite busy presenting everything else, but if somebody can please pay attention, if there's any questions in the chat that we didn't get to, or if anybody's too shy to answer, please try to get a hold of them and maybe forward it to me in an email, and we'll make sure everything gets answered.
I've been answering the questions in chat and put our contact information in there too.
Thank you, Joe.
I will say, Marian, there was a question earlier about water bills being delivered so late. Oh, you're muted, Marian.
Okay. The water bills are mailed on time. The post office is like the contractors that Barrett mentioned, that they're understaffed because of COVID. Also, we're in the last section of time where we're going to be getting those little postcards, because for convenience and for ease of payment, even though it is going to cost the city more money. I know that young as I am, we're on Social Security. We get a monthly, what are you laughing at? We get a monthly bill, and paying a third of the water bill would be easier than saving up and paying 3 months. So we're making some changes starting the end of the fiscal year, July 1st, where your water bill is going to come in a normal envelope with a normal size piece of paper that can have some explanations of what is going on for you. And even though it's going to cost the city more to administer this, to send out the bills monthly, we feel, especially during these times, that it is a service to the residents to make it a monthly payment and to be able to catch things faster. Answering the question, the city mails the bills on time, and if you're not getting them, it is a post office issue.
And I know it's been said too that you can call the department and they'll waive a late fee, just understanding that there's been.
Right. The city offices are closed until March 1st. You can, if you like bringing your payment in, you can put it in one of the drop boxes. Late payment. You can go online. You can call the water department and ask what your amount is. Not wait for the bill to come late, just get ahead of it.
And also I can say Dawn posted a file today to the Facebook group with some links to the website regarding water bills and questions on there. So there are some, as a point to start, if you have a question about the water bill, check out the website, see if your question can be answered there. So if you'll find that under files in the group.
Well, I think that, not to interrupt, but the question I had was, and I didn't mean to jump in, but mine technically, the water bill technically came about a week after my neighbor behind me, it was actually 1 day past the due date in the mail. Question is, why are they not waiving the fees online when you can pay them online if you have access to it? There's quite a fee to pay it online, which I think is absurd. I don't understand why that is. It would make it much easier for myself to go online, pay it 1, 2, 3 if I know it's got to be due. So I looked it up online. The bill is there. However, they want to charge you a fee to do that. Why?
I think it's like when you charge something at a store, the owner eats that fee because the company that does that charges.
So we're getting penalized to pay a bill then.
Well, we mail the check in. Actually, my husband likes to bring it in. You can also get I think there's an option for getting it taken out of your checking account monthly, and there is no fee on that option. So there are several options that do not have a fee attached. Pick one of those.
John, did you have something?
Yeah, I paid my water bill because I knew it was running late from the post office, but they still sent me a notice about being late, and I called City Hall and they waived the fee. So that was fine. The way that I pay my bill is through my credit union. So I have an account set up for bill pay to the city of Oak Park. So I can just automatically transfer my money to Oak Park and there's no fee.
Mhm.
So that's another way, if you're comfortable with internet banking and credit unions. That's how I handled it, because I didn't want to pay that fee either, Sandy. But if you go to a gas station, they give you a better rate for gas if you pay cash. It's a different rate if you use your credit card. So that's just true industry wise, that
Right.
you pay a little more to use a credit card. That's just a given. It's a service that when I was a retailer, I had to pay. and it just got sucked up into my profits. But that's what happens if you don't want it to suck up your profits, you charge the customer. So they pay for that convenience to use a credit card or to pay online with a credit card.
So another question, Marian, that came up this week, it seemed there were some streets that weren't getting plowed.
Mhm.
Is that something, like, should people be reporting that to people, or is there?
The streets are plowed, depending on how much snow. There was a question also about salting, and sometimes the weather is too cold that salting isn't effective. So you can put the salt out, but it doesn't do anything. So there's a window of temperatures where salting is effective. As far as plowing goes, it's the DPW's call, director's call to decide when to plow. If it's 4 inches, that makes it a snow emergency, and we order the cars off the street and plow everywhere. But I know that for less snow, they also have a way of prioritizing where they plow, and it's the main streets and the half-mile streets and those streets. And if they are salting, generally they'll salt around where 2 streets cross so that there aren't cars sliding into the intersection. When I taught in Rochester, they never, ever plowed a side street. And by February, it was an adventure driving on their side streets. We do plow, but not every snow. Oh, and the other one is every single side of the city thinks that the other side gets plowed first. So to just explain that one, the DPW director, Kevin Yee, explained to me that the first snow of the season, they might start plowing from the north. The second snow, they'll do the east side at the start. The next snow, they'll start from the south, and then they'll start from the west. So everyone feels that their side is last, but that's how it's done, to be fair.
Barrett, do you mind if I expound on your answer a little?
Please, yes, do.
I think you did a great job answering the question. I just happen, to be connected with a lot of things in the city, and I'm not directly responsible for plowing the streets of the DPW, but I can tell you the mayor's answers were right on. And there's, depending on the weather and the severity, we'll do the whole city. And other times, as you mentioned, we'll just do intersections. But if it looks like a street was missed, it doesn't happen very often, but please just call the DPW directly. They would love to know. They're overwhelmed during major snow events, but if something like that happens, please give them a call at 248-691-7497. And only do so if it appears that, a secondary street around the block got plowed and yours didn't. Thank you.
Okay. I know that for the last snow, a friend on the other side of town called and said our street wasn't plowed, and Keith got the phone and he said, looked outside, he said, yeah, ours wasn't either. They weren't doing those streets for that snow because they figured it was going to melt in a day, and it just wasn't worth paying for the snow. It's our money, it's our, whatever money is used is the money that we pay in taxes. So they're saving our money if they feel, it's a snow, it's going to be melting in a day or a day and a half. They're not going to plow that.
Well, it looks like Charlie.
A lot of decision making goes into this, folks.
Say it looks like Charlie's joined us, and I'm thinking we should have him talk a little bit.
Let's
4 minutes of our
everybody
schedule.
wants to know about getting a shot for COVID, and Charlie has the latest word from Oakland County. And just to co-opt him, Beaumont, you can call Beaumont if you are a Beaumont patient, I think. You can call St. Joe's, whether you're a St. Joe's patient or not. And pretty soon the drugstores are going to be starting to have these. So Charlie, take it away. Or commissioner, rather.
That's right. I'm wearing the button tonight. Yeah, right.
That's right.
Thank you, Mayor, and thank you, Jeffrey. Hi, sorry for being late, everybody. The perks of doing all this remote is I was typing to y'all saying, join you soon as we were adjourning the county commission meeting. So just in that spirit, one, I hope you all received, and first, thank you to everyone who asked questions, but there were 16 questions that the group asked. I forward to the health director, and the health director brought in the medical director. So I don't know if y'all have gone through that. And again, apologies for being tardy, but there are answers to all of those questions, and I'm here to make myself available after my little 30-second shtick. So Oakland County, 10 minutes ago, we just approved $10 million to take from basically our savings account and put it towards our OakGov COVID vaccine program to be able to accelerate the distribution of vaccine, to be able to also make it distributed in a more equitable way. So using a thing called the Social Vulnerability Index, which comes out of the CDC, which the state of Michigan is starting to use. Second, Oakland County got its largest dose of vaccine ever. I mean, we get them in a weekly basis. So we figure out the previous week's numbers on Friday. We hear the confirmation from the state of Michigan, what we'll get on Saturday. We get those delivered on Sunday or Monday. And then Monday at 5 p.m. is the goal for when OaklandCountyVaccine.com, which is where you can also go to save your spot, but that's the clearinghouse for any info about Oakland government vaccine. Those numbers are updated. So we got 11,300 doses this week. Our first 4 or 5 weeks, we got 1,950 doses. So what you're seeing is 1,950 to 8,000 to 11,300. So we're starting to hit our stride. I remember coming back, being here last month saying, we haven't even crested the wave yet, right? We're not even able to stand up on our surfboard because there is no wake. But we're here now, we're not standing up yet, we're not surfing, but we are seeing that something's gonna start happening. There's that from the OakGov side, and I can give you all the information you want about who to call, who to text, who to email, how to get on registered on Save Your Spot Online, or how to call the nurse on call. But before we get into that, I just wanted to say OakGov has distributed about 23,000 vaccine doses, and private, so to what the mayor was saying about Beaumont, Ascension, all these other places, CVS, have distributed about another 90,000 doses, which they've received also from the state of Michigan. So OakGov is not the only answer. And if you're over 65, Beaumont or the private systems have been the answer for you, because the government is tasked with making sure that like our sheriff's deputies and stuff get it. So that's the quick and dirty update. Happy to answer any questions.
So you did provide us answers to the questions we wrote, which I think we can also share to the Facebook group so people can read them.
So Charlie, what's your estimation? I look at the New York Times COVID map every day, and it shows Oakland County as having a fairly low infection rate, which is dropping all the time. Yet then you go to the New York Times and it says high alert, dangerous county. How does that balance out?
I haven't read the New York Times online like that. I get the Economist. So maybe I can diversify my national media, but yeah, I mean, are there other counties that you see that might also have some indicators? Is Westchester County, New York high or low? Is King County, Seattle high or low? Because those are comparable counties in size. So maybe that'll help. But yeah, in the state of Michigan, just to say, and I shared this on the Facebook group, but feel free to also reach out if you didn't see it or you don't have Facebook, which is probably better for your mental health anyways. But in all of Michigan, lower and upper peninsula, every county is red, maybe Washtenaw's yellow, Wayne County's yellow, but Oakland County is green, meaning that we have a highly efficient and effective distribution of the vaccine. So that means we have been getting 90% of the vaccine out within 7 days of receiving it. and every other place in Michigan is doing not as good as we are. So the whole issue here about who gets a shot when is based purely on supply, especially in the next few weeks when this social vulnerability index comes online and starts to be implemented in how and where distributions are arriving. Because what we've seen happen previous weeks is the hospital systems or CVS or Walgreens will get more vaccine than the government. And this week is actually the first week where that shift has happened, where OCGov got more vaccine than any one hospital system. So that also is a way to equalize the distribution. Because I don't know if you guys have heard about the cutting or all that sort of stuff, but that kind of happens through those private systems or the CVS Walgreens type thing. But the OCGov has a very rigorous system in making sure that people who are getting the shot are phase 1A or phase 1B.
So Shirley, I just wanted to add to, I saw recently too that I know that there have been issues in the past with Oakland County not getting as much vaccine as some of the counties like Macomb County, but I think at this point Oakland County is actually has gotten the most right as of today. Is that accurate?
Thank you, State Rep. So thanks to the lobbying of OakGov and our new state representative, mind you, who's able to text the governor and all that, the shouting has worked. That's part of why we went from getting less than 2,000 doses to now getting 11,300. The supply has increased, the distribution channels have improved, the logistics have been ironed out, but then also when there was more to go around because of the shouting y'all did and State Rep Weiss and all the OakGov people did, it worked. So now they said, man, you guys are not going to go away. Okay.
So when will East Oak Park get their vaccine? I'm registered in 3 places. I haven't heard nothing.
So thank you for asking that, Lester. Great question. One thing about the registration, first, I can't speak to how Beaumont, Ascension, St. John's, McClellan, Oakland, Henry Ford, what other health stuff there's going on that side of thing. I can't speak to how they're going to let you know. But they're probably pretty good, right? They have an online chart system or how the day before your doctor's appointment, they give you a quick call and say, hey, you got to show up. But from the OakGov side, if you signed up more than maybe a week and a half, 10 days, 2 weeks ago, you were not getting a response. You weren't getting a confirmation that you signed up either through Nurse on Call or online. So you wouldn't know if you actually went through the whole process. And that was one of the big headaches that our team found out when talking with all of you, is that you weren't confident that you signed up because you said other for some sort of qualifying category to get you in line. So you weren't sure if you actually got the vaccine or no one texted, called, or emailed. That has since been remedied. So we've implemented that you do get an email confirmation or a text confirmation or a phone call 48 hours before your appointment. Now the trick is the appointments aren't, because the distribution comes every 7 days, we can't schedule out your appointment more than 48 hours in advance. So Lester, when you signed up, thank you first for being dutiful and diligent and being on top of it and signing up early. But one of the side effects of that was, since we're building the plane as we fly it, you didn't get a confirmation. So you're on the list. It's just you will get a message 48 hours before your turn comes.
So in other words,
we signs up in the future will get a confirmation that says,
Thank you.
So we're signed up with Oakland County Health Department, Rite Aid, Myers, and part of the Ascension system. So all it really requires is patience?
Yeah, and just
Okay.
to give a little bit of context, thank you for that, Peter. Just to give a little bit of context too. One, admittedly, because the way that the vaccine has been just rolled out, which, I don't know if anyone was here in 1918 or cogent, being remembering what happened in 1918, but none of us have lived through one of these sorts of situations before. But saying that to say that the rollout has had its growing pains, but we're now really handling it. And so all of you that signed up at 3 or 4 places because you were scared, or I've seen online people say, this is like Hunger Games, I signed up at 5 places. One, you got to do right by yourself and your family. So no disrespect there, but you don't have to do that anymore because the hospital system, CVS, OakGov, we've all got our poop in a group now. So don't sign up at multiple places, because that then also complicates things. Because if you signed up with Beaumont, I mean, there's someone here, I think in the group here, that signed up for Beaumont, but then, and OakGov, Beaumont got them in first, so now they have to cancel their OakGov appointment. But if they don't cancel it, then you waste, 5 minutes of an OakGov.
Charlie, you gave me an email address because I asked Charlie, we got an appointment at St. Joseph's and I had signed up for Save My Spot. I said, how do I let them know that, now I don't know, he gave me an email address and what to say in short. Can you put that in the chat, Charlie?
Yes, Mayor, you got it. Will do. And it's
And it's Commissioner Cavell, so forgive me.
So it's health@oakgov.com. If you do get a vaccine, thank you, Mayor. I didn't want to call you out or anything, but yeah, health@oakgov.com, and put in the subject line, first name, last name, no appointment needed. Because you've signed up at multiple places, one, good for you for protecting your interests. You got to do what you got to do. But now that every system is better coordinated and well functioning, you don't do that anymore, because it'll add complication. Yep. And to what you said, Peter, about hurry up and wait, just to give a little bit of context, there are 1.6 million people in Oakland County, or 1.6 million doses in Oakland County that are required to reach about 70% vaccination. And we have distributed using St. John's, Ascension, Beaumont, OakGov, Meyer, Rite Aid, and then in CVS Walgreens, 178,000 vaccines. So we are, just barely scratching the surface in terms of numbers of who's been vaccinated. And mind you also that those 178,000, a lot of those are first doses. So that also adds to this. Second thing, though, in a bit of good news, because those doses and the way that the governor and the CDC have organized the phases, phase 1A and phase 1B have reached a 40% saturation rate in Oakland County. So if you are a person 65 and up, your turn's probably coming in the next couple weeks. I think you could say, you could be confident, because again, 178,000 doses, most of those went to the right people, 1A and 1B folks, which means that out of the 225,000 people in Oakland County, out of the 225,000 people in Oakland County who qualify for phase 1A and 1B, so it's about 450,000 doses, we've got 178,000 done. So we're getting closer. Any other? I'll put the email in the chat. Thank you again, Mayor. Oh, thanks, Don. Thanks, Don.
I'm sorry. No, I went ahead and registered better than a month ago, and haven't heard anything since. I've checked email every day. I went through Oakland County Health Department, haven't heard a thing, haven't seen anything in email, haven't gotten a phone call, nothing. I'm an essential worker. I'm also going to be a senior. So what am I doing? Am I waiting or what?
Yes. So two answers here for you.
Sure.
One, to what Lester said earlier about not having an answer. Because you were so diligent and signed up early, it was before the website had the capacity to send you a confirmation so that you would know that you were signed up. But now that is there. So one thing you can do is do the hurry up and wait thing. Or if you want like a better answer, you can call the nurse on call, and I'll put the number in the chat. And I don't know if you've done that, but okay, but the nurse on call has live nurses that are working for the health department, and they get up to 20,000 calls an hour, but they can have the capacity now of taking up to 50,000 calls an hour. So if you're willing to dial an 800 number and, click a couple of buttons and maybe be on hold for up to 2 minutes, no more than that, they can look up your name on a spreadsheet they got and say, you're in, or, oh, thank goodness you called us because we need to add you to the list. Is that all right?
Yeah, that's fine. I want to find out where I'm at, where I stand. Like I said, I'm an essential worker, so that's fine.
And I missed that. Did you give the number?
I'm putting it in the chat right now,
Oh,
and I
okay,
can
okay.
also give it out. Either I can say it or put it in the chat.
Chad, why don't you do both?
Okay, so the
Okay.
nurse on call is 800-848-5533. You guys ever remember when you were a kid growing up and like your best friend down the street's phone number, even though it's been like 50 years, you can still say, you know, Tommy Joe is at, 248, whatever. I feel like the nurse on call number is going to be like that. Okay. So then there's also, you can receive text updates. And that is by texting the word OakGov to 28748. Then you can also sign up to save your spot online at oaklandcountyvaccine.com. And let me put that in there too.
I can say anyone can do that. I did that a couple of weeks ago, even though I'm probably way at the bottom of the list to get a vaccine, but it made me feel like I was doing something proactive.
Yeah, that's good. Well, and so Jeffrey, to what you said about feeling proactive, there are lots of things you can do, right? You were mentioning, Peter, about how the numbers are going down. They're still too high, right? So especially with restaurants opening up, that could be one thing that is a cause for concern. So staying diligent, right? 6 feet away, wear your mask, wash your hands. Don't do stuff you don't have to do out in public if you don't have to. And then sign up for things. The text alerts are really helpful because they do send those every day or every other day. So then you can kind of be up to date. Also on the social media platforms, our team is taken to sending updates every couple days of just how things are looking with the numbers to help be a resource to answer questions. And the other thing, yeah, those are sign up for the things. Sign up for the things.
Let's say, Pat, did you have a question? You're gonna have to unmute yourself again too. Just click that microphone.
My question is it possible if you go on one of these things like nurse on call or whatever, is it possible to specify that you would like to go to a center where you're actually indoors? In my situation, I have a side effect that I get from a medication I have to take, which makes my extremities extremely cold. So in January, February weather, I cannot be outside and with my sleeves, with my arm naked. So I would like to know where I can go that's not a drive-through.
So Pat, great question. And also hope your garbage cans haven't been a bother. But so one, there's a mass distribution of vaccine this weekend at the Novi Showplace. So if you're willing and able to drive there, don't just show up. You have to call and make an appointment. But they are starting to do mass distributions at places like that, or there's a place in Madison Heights that they're doing mass distributions on weekends. So Pat, if you call the nurse on call and tell them about your unique situation, they'll be able to do a shot for you inside. Oakland County government does have 5 outdoor vaccination sites like the Novi Fire Station or the Southfield Health Department location, where you just drive up and the wait is, I mean, my fiance Katie is a counselor at Berkeley High, so she got a dose. So when we went to go check it out, it took all of 5 minutes. You just, it's like waiting for a Coke at the drive-through. So Pat, though, for you, you would want to call nurse on call, and I can give you the number again if you like.
Yes, please.
Yep. 800
800
848
848
5533.
5533.
So this circumvents having to wait?
Nope, you still got to wait because you call nurse on call and then they'll say, we have your unique situation figured out, like Pat needing to be inside.
Okay.
And they'll also figure out a close distribution site for her because Oakland County has also entered a deal recently, with Meyer. Now, what that means, though, is we're distributing those 11,000 doses we got this week to Meyer. So it expands distribution, doesn't accelerate it. But for a situation like yours, Pat, where you're not trying to be out in the cold, I mean, I live down the street from the Myers on 8 Mile here in just the other side of Detroit here in Ferndale. So like, a 5-minute drive might be better for you than going all the way to Novi or the Madison Heights Union Hall that they're going to be doing them at.
Madison Heights isn't bad.
So when you call, they'll mark that in your registration, and then you'll receive a phone call 48 hours before they have a spot open up for you. And to go back to what you said, Jeffrey, about when you signed up online, there have been over 310,000 people that have signed up to save your spot for the vaccine. And some of them are like you, Jeffrey, where, you're not 1A or 1B. But again, just for context, 22,800 doses have been distributed by OakGov. 310,000 people are signed up. But last week, that 22,800 was about half as big as it is now.
Good.
And if I could offer one more thing, if people don't have any more COVID questions.
Please.
Thanks. So another exciting thing that happened at a meeting today from 5 p.m. Now, you guys, you can't tell anybody this because this is like county commission hookup. Like, don't narc us out to the state rep or anything. Is Regina still on here? We know that the mayor's cool, but the state reps, you gotta follow these rules. But the state of Michigan, in all of their eminent wisdom, has found a way to give $500 million for rental assistance. Now, what they've also done, like geniuses, is figure out how to make that rental assistance go towards utilities as well. And I know of a couple of you on this call who I've talked to about those danged water bills. So Oakland County, because of its size and makeup, is going to be receiving soon, date TBD, but soon, $54 million for rental and utility assistance. This program is called CERA, C-E-R-A. It's COVID Emergency Rental Assistance. So, and if just to give context, the previous rental assistance program that OakGov did using your property tax dollars that pay for OakGov's like machinations and work was 3.1 plus a few more, ended up being $3.9 million. So $54 million, and it'll be around for an entire year. So I can give you, and this is going to be, this money is handed from the state to the county. The county is administering it through a group called CHN, and I can give you the phone number if you're interested, so that you can then get on like a waiting list to then be an applicant or to find out more information. Because again, this is going to come out in a couple weeks, because it's one of the funny things about government is you learn how they do like the payroll and the checks. And so, the payroll department in OakGov is like 4 people. So it's going to be really hard to figure out how to give, $300 checks, out using $54 million. So they need a couple weeks to stand it up. But do you want the number?
Yes.
Okay, 248-269-1335.
Will you also put that in the chat, Charlie?
Yes.
Commissioner Charlie.
Whatever.
This is Rob Barrett, Director of Technical Planning, City of Oak Park. Will Community Housing Network expect these calls yet?
Dang, I didn't know you're on there. Shoot. Yes. So I talked to someone at CHN who said this is a number for people to call. I don't think they're expecting like 10,000 people from Oakland County to call, but they're expecting people to start calling.
Very good, thank you.
Good question though. Thank you, sir. Yeah. As someone who works on the other side, right? You're thinking about all the systems craziness. Yeah.
And then Commissioner Cavell, is this need-based?
Great question. This is, sorry, I accidentally sent it wrong.
Oh, okay.
So it is need-based. Now, the need, from what I heard, was because Oakland County was able to work with the state on this, there's the $3.9 million that we've been using for people that are in a really tight and vulnerable situation. This money is for those people and then people that make up to an amount that I'm not certain of, but I think it's, if I'm just using the rough numbers, and anyone here who works in government who knows these sorts of formulas better, please speak up, like roughly 80% AMI. Now, don't quote me on that, but AMI, average median income, the average median income is like $75,000 a year in Oakland County. So like 80%, well, that can't be right. It's, yeah, sorry, Mayor, I don't entirely know, but it is for middle-class people as well as people who are in a lower socioeconomic status.
Great news.
And
Regina, there's a message from Sandy in the chat. I'm not sure what you two are bringing up, but I believe Michael Sutton had a question off of Facebook regarding permeable surface in their water bills and how it's measured. Is that true? I think it's the Sutton family. You need to unmute yourself if you wanted to respond. No? I may have the wrong family. I
No.
thought it
Question
was
that
them. Okay.
Sandy asked.
Oh, I'm sorry, Regina. You know what? I didn't realize that I could actually direct it to you. My apologies. I just want to know what had ever happened with the addresses that I had given you that we spoke about.
I'm sorry, Sandy. I'm completely blanking right now.
It's because it's 8:30. That's why. No,
You have my number, right, Sandy?
no, I do not.
All right, I'll put it in the chat. Why don't you call me as soon as the meeting's over, and we'll
I can do
connect.
that.
Yeah, we are approaching upon 8:30 here, which is over our normal hour time slot.
It's probably needed.
Charlie is, yeah.
Since the mayor was kind enough to step on my time talking about, thanks to a couple of you reaching out and some good advice from the mayor, I was able to reach someone in the Great Lakes Water Authority to learn a little bit more about water bills. And I don't mean to rehash this whole thing, and please, but I have the thing in my email that talks about the rate charts, and it's on the Oak Park City website. But and then what this guy Jonathan was able to provide really breaks down why the costs are what they are. So if you're looking for more information, I'm more than happy to email that to the East Oak Park group, like the steering committee y'all are on, Consetta, Jeffrey, Peter, Sam, Don. I can do that if you'd like.
Yes, that would be great. Thank you. Or just post it to our Facebook site and then we can disseminate it too.
Okay, Facebook is better for everybody?
Either way.
Either
Okay.
way, yeah.
Okay. I'll email it for Sylvia. I saw you shaking your head.
I think we'll have quite a few things to email, the COVID questions and answers, because we had just the questions listed. So now we'll have to input the answers, and then whatever water bill information you have, Charlie, will probably be adding to our email. So both will be fine.
Looking for any raised hands on anything.
Can I just make a quick
I'd like to
comment?
finish on just a few pieces of good news. Put my number in the chat also if you think of another question. But Crystal Brock posted, hi to whoever shoveled my front walk and partial driveway. Thank you. I'm a single mom who works quite a few hours, and it was an awesome surprise. So that's, to me, what makes Oak Park a special place to live, is people like that. Then if you weren't able to make the last council meeting, Public Safety Director Stephen Cooper gave public safety citizen citations, which is unusual. One went to Tiana Meadows, who was a teenager who was riding her bike and someone stopped her to ask for directions and exposed himself. And she had the presence of mind to take a picture of his license plate and then identify him in a lineup, dressed, of course. Sorry, but that's really keeping your head in a crisis, I think. I was so proud of her. And then Curtis Hicks was driving, I think down Oak Park Boulevard when a car had driven into a tree and caught fire, and he stopped and pulled the people out of the car to save them. Here is somebody driving by, not just saying, oh, well, I hope somebody does something, but taking ownership and actually doing it. I was so impressed with her, grace under pressure. And I'll put my number in if anybody has questions, but I thought that's the kind of thing that reason that people like moving into Oak Park, because of people like you who are caring. So thank you.
Thank you for sharing, Marian. Regina, you had something too, I think.
Yeah, I feel bad though, because mine isn't as nice as.
Oh.
I wanted to kind of comment really quickly on something that Charlie had mentioned about the utility and rental relief. We did pass in Lansing today some supplemental budget amendments to allocate some more funding for COVID relief. I will tell you, I voted against each of these amendments, not because they were supplementing more money, but because they were not supplementing nearly enough. Basically, we qualified for billions of dollars in federal relief money that we just didn't ask for. And we put forward some amendments to request the full amount. We weren't even allowed to vote on those amendments. And so it's pretty frustrating. Hopefully we'll keep pushing for it, because right now we have a lot of our tax dollars sitting in Washington, D.C. That's due back to us for this relief money, and we just are not appropriating it for some reason that I will never understand. But we'll keep pushing for it. So just wanted to let everyone know that. To Charlie's point, we appropriate 165 million of the 661 million we could have. So I know everyone, we need that money now. We need it desperately. So we'll keep pushing for that moving forward.
Thank you definitely for fighting the good fight here. It is almost 8:30. Does anyone have any further questions? I'd like to thank you all for coming tonight. Marian and Rob and Joe and Regina and Charlie. It's always a treat. It's great that we live in a city where we have people willing to give your time to talk to us as just citizens here, especially because we're over time too. So it's nice to clear up things and hear it straight from the top as opposed to hearsay. There's a lot of that around as well. And as always, if people have discussion or topics that you'd like to see us explore or guests that you'd like us to see, please contact us. Shoot Dawn or Sam or Zig or Peter or myself a message, and we'll see what we can do. I know I messaged Lori and said that, yeah, we should talk about trash in the city. And maybe as the weather gets nicer, we can do some sort of a cleanup and come up with some ideas that might help be less trashy.
Yeah, that's a problem on these overpasses, which is getting to be overly talked about and overly done. It's the same thing every time. It really looks bad, but that's probably a whole other discussion. That's I've even talked to Ziggy about it. We need to get cameras up there. It's the same thing every day. I pass by the same overpass. It gets cleaned up, comes right back in the same place. I don't know what it is, but
I just have to say that Karen, Yaldo, myself, Jeff, Sandy's, and another fellow in Kemerton, they have helped. We have volunteered to just go out there and do it ourselves. Actually, we've walked all the way from Roanoke all the way to Woodward. The whole service drive gets trashed. We do that. But we also go around this park here and the overpass, and it is an ongoing problem. It's something that we're not going to get solved by the public system. I think we just have to kind of volunteer on that. But I wouldn't mind seeing cameras for speeding and for throwing dirt. If that could be something doable, I would be happy with that. But I've brought it up before, and most people are telling me you can't do the cameras. It's too much invasion of privacy. So I don't know. But if anybody wants to join me and some of my group, we could start over here at Best Elementary, especially when the weather gets better, and do at least a monthly tour of the place and bring some trash cans. And I even bought a special grabber so I could pick up the garbage. I don't even have to bend down anymore. So.
To Siggy's point, Ben Weston is a 10-year-old, and he was given an assignment in 5th grade by Mr. Williamson called Lend a Big Hand, something that would contribute to the common good. And he and his mom came up exactly with what Ziggy said, that they every Saturday they go out and collect trash. And and he asked, I'm writing to ask if you could bring attention to this issue, and maybe when it's safe again, we could have a city cleanup day and encourage others to join us in keeping Oak Park beautiful. This comes from a 10-year-old. So I call it the Ben Weston Challenge, and let's all contribute to the common good. And I walk 5 times a week sometime. All I have to do is start taking a trash bag with me and own it. So join me and join Ben Weston and Ziggy, and let's go make it better for all of us.
Here, here. That's awesome.
Jeff, would you mind if I said one more thing as well?
Sure.
If everyone, if you know that's in here, if they're praying people, if they could keep the Holler family in their prayers. They're members of the Oak Park Bot Club. In December they had a house fire, and then in late December, early January, their hotel that they were staying in caught fire, and just earlier or end of January, Stan sadly passed away. So keep Mary and their whole family. If you're praying people, keep them in your prayers, and if you're not praying people, keep them in your thoughts.
Where are they living? And
they have a rental house now. They're out of a hotel, but I'd prefer not to give their address. But they are East Oak Park residents and East Oak Park Block Club members and attendees. So
they probably need everything.
The house was salvageable. It was a chimney fire, so they will be able to rebuild. Or it's actually not. It wasn't a full loss. So, but their daughter and granddaughter were living with them. So, just keep them in your thoughts and prayers.
Thank you. Another thought and prayer. City Council member, Mayor Pro Tem Carolyn Burns, lost her brother, who was her best friend. They called a couple times a day to COVID. Family lost 2 uncles in the same 6 months to COVID. And Monday, their 17-year-old son passed out in the kitchen. When EMS came, his heart stopped.
Oh, geez.
So he is deathly ill. So if you are praying, pray for Carolyn Burns and her family.
That's a shame.
For healing.
A group of us did go in together and buy some face masks for the Haller family because we were concerned about them. And they were made by a local neighbor, Margie Marshall. So a group of us did donate to the family a group of masks for them. Just a small gesture of kindness to let them know we're thinking about them. And but yeah, the funeral I think was just this past weekend for Stan.
Let me add something else, please. It's a different subject, but I'm still doing my exercise classes, which are free. We're over here at the best school, 10 o'clock Sunday mornings. It's cold right now, but believe it or not, you're gonna lose twice the calories with half the work. And Wednesdays at 5 o'clock, same place, best school.
The last thing on the Holler family is they go to my church. That's how I know them. We do have a meal list set up for them. So if any of you guys were close enough to them that you would want to help participate with that, feel free to reach me at my city email or phone number.
Hey, good night, everyone.
Great.
Okay,
Yeah.
Diana. Joseph, if you want to leave your email in the chat, that would help. Rob, we need to talk about the video because I usually post it to Oak Park Facebook site. So I think when you started the record, you were saving it to your cloud.
I'll try to figure out where it's recording to and reach back to you.
All right.
Good night,
Thank you.
everybody.
Good night.
Thank you all for your time. Thank you all for
Thank
giving us
you.
the extra 38 minutes. It was a good meeting.
Thank
Thank
you.
you,
Thank you, everyone. Good
Jeffrey.
night.
We'll see you next month.
Thank you, everyone. Stay safe.
Good night. You too.
Good night.
Bye for now.
Good night.
Good night.
Good night.
I don't know how we're gonna get that video from Bob or Rob, but
It probably will save onto, well, it's still recording right now.
is
So
it?
because you're the host, it might end up being on your computer. Maybe once we're all done, we all
I'm
leave.
stopping. Yep, I'm stop